Here's a critical fact that often gets confused. Mesothelioma is caused by asbestos exposure and not by smoking. But if you have mesothelioma and you smoke, or if you were exposed to asbestos and you smoke, your habit creates additional serious health risks that can affect both your prognosis and available treatments. Today, I want to clear up the confusion about smoking and mesothelioma and explain exactly how smoking impacts mesothelioma patients. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice, but understanding the relationship between smoking and asbestos-related disease could literally save your life. Let's start with what we know for certain. Smoking does not cause mesothelioma. This has been studied extensively. The rate of mesothelioma in smokers who were never exposed to asbestos is the same as in non-smokers who were never exposed to asbestos, essentially zero. Mesothelioma requires asbestos exposure. Smoking alone without asbestos exposure does not produce mesothelioma. This is fundamentally different from lung cancer, for which smoking is the primary cause. About 85% of lung cancer is caused by smoking, but mesothelioma is different. It's an asbestos disease, not a smoking disease. However, and this is crucial, smoking does dramatically increase the risk of lung cancer in people who were exposed to asbestos. If you were exposed to asbestos but you never smoked, your risk of lung cancer is about 5 times higher than that of someone with no asbestos exposure. If you were exposed to asbestos and you smoke, your risk of lung cancer is about 50 to 90 times higher than that of someone with neither exposure. This is called a synergistic or multiplicative effect. The two exposures together create far more risk than the sum of their individual risks. It's not that asbestos risk plus smoking risk makes a combined risk. It's that they multiply each other's effects. So if you were exposed to asbestos and you currently smoke, you need to quit immediately. Not for your mesothelioma risk. That ship has sailed because your mesothelioma risk is determined by asbestos exposure. But it's definitely true for your lung cancer risk, which is astronomical if you continue smoking. Now, I'm going to take a break here to ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comments section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, moving on, let's talk about whether smoking affects mesothelioma prognosis and outcomes if you already have the disease. The research on this is more limited than on lung cancer risk, but what we know suggests several ways that smoking can negatively impact patients who do have mesothelioma. First, smoking damages your lungs and it reduces your lung function. If you have pleural mesothelioma, your lung function is already compromised by the disease itself, by pleural thickening that restricts lung expansion, by pleural effusion that compresses your lungs, and by tumors that limit your respiratory mechanics. Adding smoking-related lung damage on top of mesothelioma-related damage creates compounded respiratory impairment. This matters for symptoms. A mesothelioma patient who smokes may experience worse shortness of breath than a non-smoking patient with a similar degree of disease. Smoking-damaged lungs have less reserve capacity to compensate for the mechanical restrictions that are caused by the mesothelioma. It also matters for treatment. Many mesothelioma treatments have respiratory side effects or require the patient to have adequate lung function. Surgery for pleural mesothelioma, procedures like pleurectomy or decortication, they require that the remaining lung tissue has adequate function. If your lungs are already damaged from smoking, you may not be a surgical candidate even if you otherwise would be. Chemotherapy and immunotherapy can sometimes cause respiratory complications. Patients with smoking-related lung damage, they may tolerate these treatments less well and may be more likely to experience serious complications. Second, smoking impairs immune function. Your immune system is critical for fighting cancer, and immunotherapy treatments, they specifically work by enhancing immune responses against cancer cells. If smoking has impaired your immune function, the treatments may be less effective. Third, smoking affects healing and recovery. If you undergo surgery, smoking is going to slow your wound healing and increase your risk of complication. Smokers have higher rates of postoperative infections, pneumonia, blood clots, and other complications. For major surgeries like cytoreductive surgery with HIPEC or thoracic surgery for pleural mesothelioma, these additional risks can be very serious. Fourth, smoking may affect your treatment eligibility. Some clinical trials exclude current smokers, and some surgeons will not operate on patients who continue to smoke because the complication risks are just too high. By continuing to smoke, you may close the doors to some promising treatment options. Fifth, there's the additional cancer risk. As mentioned, smoking plus asbestos exposure creates extremely high lung cancer risk. A mesothelioma patient who smokes could develop lung cancer as a second primary cancer. Managing two simultaneous cancers is obviously far more challenging than managing one. There's also preliminary evidence, though this is less well established, that smoking may affect tumor biology in ways that make cancers more aggressive or more treatment resistant. These mechanisms aren't fully understood yet, but there are biological reasons to think that smoking could influence how mesothelioma tumors behave. Now, what about marijuana or cannabis use? This is a question that comes up more frequently now that cannabis is legal in many states and is sometimes used by cancer patients for symptom management. The research on cannabis and cancer outcomes is extremely limited. Smoking cannabis does expose the lungs to combustion products and tar, though cannabis smoke and tobacco smoke aren't identical. If you're using cannabis for symptom relief, first, it needs to be under medical guidance. But go with edibles or other non-smoking forms of administration to avoid the respiratory exposure. Smoking cannabis adds respiratory insult on top of mesothelioma-related lung compromise, so it's just not ideal. We get asked about vaping or e-cigarettes too. Well, vaping doesn't involve combustion like traditional smoking. It's not harmless. Vaping has been associated with some severe lung injuries, and for someone with compromised lung function from mesothelioma, adding any additional lung insult is risky. If you have mesothelioma and you currently smoke, quitting should be a top priority. This is hard advice to give because you're already dealing with cancer treatment, fear, and stress. I know that smoking is a powerful coping mechanism and that telling someone to quit smoking when they've just been diagnosed with terminal cancer can seem cruel. But the reality is that quitting smoking can improve your quality of life, even in the short term. It can improve your breathing, reduce coughing, and improve how you feel overall. It can improve your treatment options and outcomes, reduce your risk of complications, and dramatically reduce your risk of developing lung cancer on top of mesothelioma. Also, there are some great resources for quitting, including nicotine replacement therapy patches and gums and lozenges that are available over the counter. There are prescription medications like, I can't pronounce these, varenicline and bupropion that reduce cravings. Counseling and behavioral support through quit smoking programs, support groups, and quit lines like 1-800-QUIT-NOW. If you tell your oncology team that you smoke and that you want to quit, they can help. Most cancer centers have resources for patients who want to quit smoking. They understand how difficult it is and can provide the support you need. A lot of patients who've been diagnosed say they quit smoking years ago, before their diagnosis, and they want to know what the impact of that smoking history has on their treatment. It's a bit of a mixed bag. Your past smoking history definitely increases your lung cancer risk, but quitting reduces that risk over time. The fact that you quit years ago means your lungs have had time to heal a bit. Your immune function has recovered, and you're in a better position to tolerate treatment than if you were still smoking. What if you quit recently, after you were diagnosed? That's still beneficial. Every day without smoking allows some recovery of lung function and healing capacity. And even quitting shortly before your surgery or treatment can improve your outcomes. So to review, smoking doesn't cause mesothelioma, but it does increase the risk of lung cancer in individuals who've been exposed to asbestos by 50 to 90 times. As for mesothelioma patients who smoke, continuing to smoke is going to worsen your lung function, reduce your treatment options, increase your complication risks. It may reduce your treatment effectiveness and maintain a high lung cancer risk. Quitting will improve your quality of life, your ability to tolerate your treatment, and improve your outcomes, even if you only stopped a short time ago. If you smoke and have mesothelioma or you've been exposed to asbestos, quitting is critical. Visit mesothelioma.net for more information about how smoking impacts your risk of lung cancer, or to speak to one of our patient advocates right away. Call 1-800-692-8608 or use the live chat feature on the website. As for me, remember to post your questions below, and I'll see you next time.